Cervical cancer: causes, symptoms, diagnosis, and treatment. Overview. Cervical cancer is a type of cancer that develops in the cervix, the lower part of the uterus that connects to the vagina. It is one of the most preventable and treatable cancers if detected early through regular screening, pap smears, and HPV vaccination. The primary cause of cervical cancer is persistent infection with high-risk types of the human papillomavirus, HPV, a common sexually transmitted infection, STI. Causes and risk factors. 1. HPV infection, main cause. Certain types of HPV, especially HPV-16 and HPV-18, cause about 90% of cervical cancer cases. HPV is transmitted through sexual contact, vaginal, anal, or oral sex. 2. Risk factors that increase the likelihood of cervical cancer. Multiple sexual partners increases exposure to HPV. Early sexual activity, higher chance of HPV infection. Weakened immune system, e.g., HIV or long-term use of immunosuppressants. Smoking damages cervical cells, making them more vulnerable to cancer. Long-term use of birth control pills, more than 5 years. Lack of regular pap smear screening, missed early detection of precancer cells. Family history of cervical cancer, genetic predisposition. Symptoms of cervical cancer. Cervical cancer in its early stages may not cause symptoms. That's why regular screening is crucial. As the cancer progresses, symptoms may include early symptoms, abnormal vaginal bleeding such as bleeding between periods, heavy or longer than normal periods, bleeding after sex or menopause, unusual vaginal discharge, sometimes watery, foul-smelling, or blood-tinged, pain during or after intercourse, advanced symptoms, pelvic or lower back pain, painful urination or blood in urine, swelling in the legs due to blocked lymph nodes, loss of appetite, weight loss, or fatigue. Diagnosis of cervical cancer. 1. Screening tests for early detection. Pap smear, pap test, detects abnormal cervical cells, precancerous or cancerous. HPV test identifies high-risk HPV strains that cause cervical cancer. 2. Diagnostic tests if screening results are abnormal. Colposcopy, a magnified view of the cervix to check for abnormal cells. Biopsy, small tissue sample is taken from the cervix for lab testing. 3. Staging tests to determine cancer spread. If cancer is confirmed, further tests may include MRI, CT scan, or PET scan to check if cancer has spread. Pelvic examination under anesthesia, in some cases. Stages of cervical cancer. Stage 0. Carcinoma in situ. Abnormal cells are only in the surface layer of the cervix. Stage I. Cancer is in the cervix, but has not spread beyond it. Stage 2. Cancer has spread beyond the cervix to the upper vagina, but not the pelvic wall. Stage 3. Cancer has spread to the lower vagina, pelvic wall, or nearby lymph nodes. Stage 4. Cancer has spread to distant organs like the bladder, rectum, or lungs. Treatment options for cervical cancer. 1. Precancerous lesions. Early treatment. Cryotherapy or laser therapy destroys abnormal cells. Loop electrosurgical excision procedure, LEP, removes precancerous tissue. 2. Early-stage cervical cancer, stages 1 and 2. Surgery, removal of the cervix, trachelectomy, or uterus, hysterectomy. Radiation therapy, high-energy rays target cancer cells. Chemotherapy, given alongside radiation in some cases. 3. Advanced cervical cancer, stages 3 and 4. Radiation and chemotherapy, combined treatment, used when surgery is not an option. Targeted therapy, e.g., bevacizumab, stops cancer from growing new blood vessels. Immunotherapy, e.g., pembrolizumab, helps the immune system fight cancer. Prevention of cervical cancer. 1. HPV vaccination. Recommended for girls and boys aged 9 to 26. Protects against high-risk HPV types 16 and 18. Most effective if given before sexual activity begins. 2. Regular screening, pap smear, and HPV test. Every 3 years for women aged 21 to 29, pap smear. Every 5 years for women aged 30 to 65, PAP plus HPV test. 3. Safe sexual practices. Use condoms to reduce HPV transmission. Limit the number of sexual partners. 4. Quit smoking. Reduces the risk of cervical cancer. 5. Maintain a healthy immune system. Manage conditions like HIV and diabetes. Eat a nutritious diet and exercise regularly. When to see a doctor. Unusual vaginal bleeding or discharge. Pain during intercourse. Persistent pelvic pain. Miss cervical cancer screenings. Conclusion. Cervical cancer is highly preventable and treatable if detected early. Regular pap smears, HPV vaccination, and a healthy lifestyle play key roles in reducing the risk. If diagnosed early, treatment is very effective with a high survival rate. Would you like recommendations on HPV vaccines or information on pap smear tests?